All right, thank you, Dr. Borgstrom. As many of you guys know, I'm Katherine Carruthers. I'm the PGY6 in plastic surgery. And today I'm going to be talking to you about pet power, the health benefits of animal-human relationships. Admitted. Perfect. Okay. So a brief overview of what we're going to be talking about today. I'm going to touch on the origin of our modern dog, some health benefits of having household pets in general. I'm going to define the three main types of medical working dogs, which include the emotional support dog, the service dog, and the therapy dog. I also wanted to share a little bit of my personal journey towards therapy dog certification with my own pup, Buttercup, and we're still in the process of working through that. And I'll tell you about where we stand in that, as well as some of the benefits of having therapy dogs in the hospital in general. And then should any of you want to order pet therapy for any of your patients, I'll go through the steps of how to actually put in those orders and get the orders implemented here at WVU. Before I get started, I wanted to take a minute and say thank you to the WVU therapy dogs who came out this morning to meet all of you and support my talk today. So I was going to give a brief introduction of who we have here with us today. Sorry. This is Han. He's one of the newer therapy dogs. He's a German Shepherd, about 2 years old, a little over 2. My name is Amelia. I primarily work in the Cancer Center as a medical assistant. I've worked with some of you guys, some of you residents. I work with breast surgery, so Dr. Hazard. So if I haven't gotten to meet you, I don't know. But my goal has been working with him for about 2 years. He is my personal pet. I want to get that German Shepherd mentality out of everybody's head. German Shepherds are not bad dogs. He is probably the biggest goofball and the laziest German Shepherd you will ever meet. And he's been like this since he was a pup. But he's absolutely like, he loves people. He's super whiny and he loves to talk. He's talking to poor Max here in the elevator, like wanting to play with him. So we look forward to meeting you guys. And then if you guys need anything, just let us know.
Hi, I'm Holly. This is Max. He is an Old English sheepdog. He is also deaf and vision impaired. He's a rescue pup. And he's 3 years old. Been doing this right before the pandemic we started. But yeah, if you ever want to see the world, I'm happy to do that. He was also, this is Lucy. I'm with the department surgery. A lot of residents at the children's ward and in the hospital. Sometimes we visit the surgery residency program. She also is a playful dog and loves to play with friends. And she's so excited when she saw Max and Han come in. She thought it was play day. So if any of you also want to let us know.
All right, thank you guys. And we'll save a little bit of time at the end for you all to meet them one-on-one if that's something you want to do. So before I get started, some disclosures and disclaimers. I am definitely not a professional dog trainer by any means, but fortunately there are a lot of great organizations throughout Morgantown that can help you with dog training or therapy dog training if that's something you're interested in at the end of this talk. I do name some of those groups by name, but I'm definitely not affiliated with any of them in particular. I have found that all of the groups I have worked with are all very friendly and they always welcome new people and new faces. So if you are interested, never hesitate to reach out and get more information from those groups directly. I knew very little about this process when I got started, and just cold calling people is how I started the therapy dog journey with Buttercup. All right, so dogs in the wild. There are about 800 million dogs on Earth, and about half of them live with humans as domesticated pets. Dogs are the first domesticated animal, and most researchers who study canine genetics agree that dogs originated from the domestic gray wolf. Although the exact time of this relationship between wolves and humans is still somewhat disputed. Early studies suggest that dogs were domesticated anywhere between 12,000 and 15,000 years ago. But more recent genetic studies suggest that domestication may have taken place much earlier. Some researchers believe that dogs may have commingled with humans as early as 130,000 years ago. Since then, dogs have become the best example of any species that has evolved to coexist with their humans. And today, dogs are strongly integrated into our daily lives. From the wolf to the American house pet. In the United States, there are approximately 80 million homes that have some sort of pet in the family. That represents 65% of all American households and makes America one of the highest rates of pet ownership in the entire world. Most families, like my own, have pets that are important members of the family, and the pet owners and pets typically form very strong bonds. Pets can serve as a source of support and reduce anxiety, stress, and depression. Many studies have verified that animal interactions exert a physiological effect on the human by reducing blood pressure and heart rate, which can lead to decreased cardiovascular disease risk. Other well-documented benefits of pet ownership include companionship and an improved response to stress, as indicated through measurable increases in dopamine, cortisol, and oxytocin. A 2018 meta-analysis looking at human-animal interactions identified 4 main themes of pet ownership relationships with their humans. The first was comfort and safety. The second was social inclusion and participation. The third was purposeful routine and structure. And the fourth was a meaningful role in society. These benefits may also increase resilience in children and older adults and protect against mental health disorders, which may positively influence their mental health outcomes. Individuals with chronic illness have a greater risk of developing anxiety and depression. Studies have shown that there's as much as a 4 times higher rate of depression among cancer patients compared with the general population. Similarly, there are high levels of anxiety and depression, which have been reported among spouses and close family members of patients with chronic illness. For these reasons, pets are increasingly included in the therapeutic approach to mental health problems and chronic diseases. The effects of animal interactions have been described as similar to those of complementary medicine, where patients seek ways to regain a sense of control for their own disease and improve their quality of life. But what else can dogs do for their humans? When you think of working dog, something like this probably comes to mind: sled dogs, hunting dogs, or police dogs. But in the world of medicine, there are 3 main types of medical working dogs. That's the service dog, the therapy dog, and the emotional support dog. Each of these types of dogs has a very specific goal, a very specific definition, and a task that they must achieve. We'll go through each of these types of dogs separately, starting out with the emotional support dog. Although all dogs offer emotional connection with their owner, to legally be considered an emotional support dog, the pet needs to be prescribed by a licensed mental health professional to a person with a disabling mental illness. That means a therapist, psychologist, or psychiatrist must determine that the presence of the animal is absolutely necessary for the mental health of the patient. An example of this would be an emotional support dog, which might ease a person's anxiety and allow them to live a more independent lifestyle. This may enable patients to live in traditionally no pet apartments or take their dog into public places where animals would otherwise be prohibited. Emotional support animals can be of any age or any breed, and they don't even need to be dogs. One thing to keep in mind, though, is that these animals are not legally considered service dogs. Several years ago, there was a dramatic increase in the demand for emotional support animals, particularly by individuals who may not necessarily meet the requirements to own an emotional support dog. And this was in order to take advantage of the benefits of bringing pets on airplanes or avoiding no pet limitations in apartment buildings. And some of these are actual examples you can see here. However, as recently as 2020, as you can see in this article from NPR, there's been a bit of a crackdown on the limitation of the use of emotional support animals. It says the new Department of Transportation rule is in response to a growing backlash in recent years to airline passengers trying to bring all kinds of wildish and outlandish pets onto planes, including a woman who tried to bring an emotional support peacock aboard American Airlines flight in 2018, and a comfort turkey who was actually allowed to fly on Delta in 2016. So what is a real service dog? There are approximately 500,000 service dogs in the United States. Service animals are defined as dogs that are individually trained to work or perform tasks for people with disabilities. Examples of this work would include guiding a patient who's blind, alerting patients who are deaf, pulling a wheelchair, protecting a person who is having a seizure, or reminding a person with a mental illness to take prescribed medications. Service dogs and handlers are protected by the Americans with Disabilities Act. All organizations which serve the public generally must allow service animals to accompany patients with disabilities in all areas of facilities where the public is otherwise allowed to go. Here at WVU, we actually have a service dog training program. It's called the Hearts of Gold, and it provides service dogs for individuals with mobility impairment or post-traumatic stress disorder. They partner with the School of Animal and Veterinary Sciences to provide an interdisciplinary program for our WVU undergraduate students. The program offers university courses in service dog training and is developing research projects, providing other services to our community. So I've got a quick video about how the service dogs are trained here at WVU. Hopefully this works.
I got her when she was about 10 weeks old, and she looked like a little polar bear. She was so cute. I couldn't resist her. It's nice to come home with someone who's always excited to see you and love on you. It's unconditional love at its finest. She's definitely not just a dog. She's family to me and my best friend. Come on. Ready? You have to adjust your training skills for each dog that you have, their personality. Yes, good girl. I love the moment where they actually get it and they have that aha moment. It's really cool. Yes, good girl. I've always wanted Abby to go to someone with PTSD. I've kind of been rooting for that. She's very good at reading body language and being there for you emotionally. You can definitely save someone's life just with a really good bond. I'm definitely. I've kind of been rooting for that. She's very good at reading body language and being there for you emotionally. You can definitely save someone's life just with a really good bond. I'm definitely proud of Abby. It's going to be really hard giving her up.
I learned about the service dog training program through a friend. At the time, I was just manifesting like physiological symptoms of stress. I'd written off any human helping me, any person, and so I didn't think an animal would come close to being able to help me. And I didn't want to take drugs. There was a lot of things that I didn't think Dally was going to be able to help with. But I was wrong. When I was sleeping better, I was probably a happier person and probably looking a little healthier too. Good girl. She provides the service without even knowing that she's doing it. She depends on me to take care of her. So I am constantly thinking of what she needs. I'm no longer thinking about other people around me. Whereas before I was overwhelmed with everybody. It allows me to focus on what I need to get done. I know that she is always right there for me. She's my support. It's been wonderful.
So that's a resource at WVU that I actually was not familiar with. So it's something I want to share with all of you. So if you know of any of your patients who are in need of service dogs, it is an option to bypass the traditional wait time for service dogs if they participate in the training program here. All right, moving on to therapy dogs. Therapy dogs provide relief to individuals in anxiety-provoking situations, bring comfort to those who are grieving or lonely, and offer affection to people in hospitals, nursing homes, or schools. Hospitalization is a stressful life event, causing sudden disruption in daily routines. Animals have been implemented into pet therapy programs to help improve this stressful situation. So I want to take a minute and talk about my journey to pet therapy dog training with my dog Buttercup. This is her at 6 weeks, actually a little bit before I got her. I got her when she was 8 weeks. And then her at about 3 months old at one of our vet appointments. And Buttercup's a Great Dane. Great Danes are native to Germany, also known as the German Mastiff. They're anywhere from 28 to 32 inches tall at the shoulder, and adult males can weigh up to 175 pounds. They only live about 7 to 10 years, but are very affectionate with family members, good with young children, and very adaptable to new situations. So they're deemed the gentle giant of dog breeds. This is actually a picture of Buttercup's mom. She was a show dog, but my plans for Buttercup were a little bit different. She is destined to become a therapy dog, I hope. So large breeds are easier for patients to reach from a wheelchair, can also assist patients with balance and mobility issues, and they have a very patient understanding nature, which makes them particularly well suited to assist others. So when I picked out Buttercup, this is our ultimate plan. So the question became, how does one become a therapy dog and a therapy dog handler team? Turns out there's just not one certifying group. The American Kennel Club actually recognizes about 216 different certifying organizations, and they all have different requirements for certification. Although definitely not standardized, some organizations require dogs to pass an AKC Star Puppy test, and then go on to take basic obedience, followed by the Canine Good Citizen test, all before they begin their therapy-specific training. Other groups, however, just require dogs to go straight into the therapy-specific training as long as they're over a year of age. And then aside from the basic obedience, dogs must naturally possess a social temperament and must want to be part of the team. So I did some Googling and said, where can I get therapy dog training here in Morgantown? And I found this place called Mountaineer Kennel Club. It's out on Point Marion Road, about 20 or 12 minutes from the hospital, so not much of a drive. And their website showed that they had all of the classes necessary for us to get our therapy dog certification. So you start out with the Star Puppy training, which tests your young puppy over about 20 items in the class. Then after you get your certification there, you do basic obedience before beginning your Canine Good Citizen testing, which takes the 20 items in the Star Puppy course to a new level with more distractions and different challenges. Then after you've completed that course, you can move forward to therapy dog training, which is for dogs over 12 months of age who are introduced to obstacles such as wheelchairs, carts, walkers, or other items that they might encounter in medical facilities or nursing homes. So here's an example of the Star Puppy test. Some pretty basic items on here, but for a young dog, it can sometimes be a challenge to do a down command, sit command, walk on a loose leash without too many distractions, be able to complete all of those tasks. So Buttercup and I went out to the Mountaineer Kennel Club and we took the AKC Star Puppy class. We actually ended up taking it twice because they require perfect attendance and the resident call schedule does not always correlate with perfect dog school attendance. So our 3-month course became a 6-month course. And we were actually the only dog who has had to take the test twice, but that's okay. We had a good time. We met a lot of other nice people and nice dogs. And we eventually did get our certification. So congrats to Buttercup there. And now we're working towards the Canine Good Citizen testing, which has some similar items as the Star Puppy, but a lot more distractions. You leave your dog in someone else's care and they can't whine. They have to walk through a crowd and walk past other dogs and still be able to perform these tasks. So it might seem easy, but this is something we're still working towards. So the question is it all worth this effort? And the short answer is yes, it is. And there are actually a lot of studies to back up that statement. Hospital-based pet therapy is typically defined as an interaction between a patient and a certified animal for therapeutic purposes and to help improve the patient's physical and psychological well-being. These programs encourage patients to sit, touch, play, groom, and/or talk with a therapy animal. Within the hospital, therapy dogs provide relief to individuals in anxiety-provoking situations, bring comfort to those who are grieving or lonely, and provide affection. By incorporating a brief pet therapy visit into routine patient care, we can have a relatively low-cost, non-pharmacologic intervention which decreases anxiety, promotes patient satisfaction in both the patients and their families in the hospital setting. So a typical therapy dog visit involves spending about 10 to 15 minutes petting or playing with a trained therapy dog while the handler monitors, tends to the dog's need, and answers any questions. The dog's handler also ensures that infection control protocols are followed to avoid the spreading of infection. At WVU, therapy dog visits are provided through volunteer services who actually coordinated this visit here with you guys today. And they're targeted at patients, visitors, students, and healthcare workers, which includes all of you, residents, to help reduce stress and enhance mood. So I have a quick video I wanted to show you, and this is some therapy dogs here at WVU interacting with our pediatric patients.
The saying goes, a dog is a man's best friend. But what if that friendship can extend to the hospital? With pet therapy, patients are reaping the benefits.
Well, therapy dogs are allowed in hospitals, nursing homes, and their purpose is just basically to help patients cope with whatever they're about to get done with procedures, if they're scared. A lot of times a therapy dog for a child, a lot of the children have pets at home. They miss their pets if they're having a long hospital stay. It can also decrease anxiety. It can bring, just kind of a furry, friendly buddy while they're getting, whether it's, they're scared about a shot, they're scared about an IV, or they're not sure about a procedure coming up. And it can also serve as a distraction too, as well.
Other forms of pet therapy include service dogs and emotional support animals. Studies have also shown that pet therapy, or even owning pets, can greatly benefit your cardiovascular and mental health.
I think the number one thing that patients say is, they're my best friends. They don't say anything mean, but they know exactly how I feel. And I think that's simple, but very profound.
Kyria is a proud owner of a 1-year-old husky and hopes to begin training her to become a therapy dog soon. In Morgantown for the WVU Medicine Health Report, I'm Dr. John Phillips.
The benefits of pet therapy were first published in 1962 study, and subsequent studies have consistently shown that there is a valuable treatment modality in various patient populations. Though most studies were initially done in psychiatric and geriatric patients, smaller studies have confirmed these results in both pediatric and traditional adult patient populations as well. In children, the immediate postoperative period, one study reported lower pain perception in the pet therapy group versus those who received standard postoperative care. Outcomes were assessed through questionnaires, which found that dog visits had more positive responses on the pediatric patients than traditional human interactions or interactive reading time, making required medical interventions easier for both patients and their parents. This 2015 study looked at the effects of the presence of a dog during venipuncture on distress, pain perception, blood cortisol levels in children ages 4 to 11, as well as anxiety and distress in their parents. Children who were accompanied to their venipuncture visits by a dog demonstrated lower levels of observable distress than those who were accompanied by just their parents, and also had significantly lower levels of serum cortisol. Some patients were able to withstand treatments for longer periods while they were in the presence of a therapy dog. Interestingly, one study testing patient attitude towards pets found that the psychological benefit was independent of baseline pet attitude scale score, which means that even patients who are not particularly interested in pets before their hospitalization still found benefit when interacting with an animal in the hospital. But it's not just the pets that benefit. Studies have shown that therapy dogs also benefit from their work, with higher levels of endorphins and oxytocin compared to the therapy dogs to the average family pet. So part of the plastic surgery curriculum here is we get to rotate through a lot of different hospitals, surgery centers, and private practices. So I've had the joy of meeting a lot of therapy dogs along the way. And some of you guys may have rotated these same places and met some of the dogs. So I want to take a minute and highlight some of the dogs we've met. This is a pup that I met at our aesthetic surgery rotation in Pittsburgh with Dr. Heil. The plastics residents go out to UPMC Mercy for 2 months of burn surgery, and there were therapy dogs out there. For one of my electives, I went out to Columbus to look at microsurgical breast reconstruction with Midwest Breast, and they had therapy dogs at their office as well. And then, like the rest of the general surgery residents, we go out to Baylor Scott and White in Dallas for a transplant experience. And I actually got 2 pet therapy visits while we were out there. But it takes a lot of time to get there, and my dog is not quite there yet. However, we're still working. We're getting there. She's much bigger now, but we're still working towards getting that Canine Good Citizen certification. In the meantime, she's still a member of my family and the WVU family as well. Been frequently visiting all of the picnics, and most of you guys have met her at one point or another. Here at WVU, there are already some therapy dogs certified and ready for your interaction, as you've witnessed today. So Gus was supposed to be here today. He's not, but we also have our new sheepdog Max to represent. And there are other dogs, obviously, who are enrolled in the program who weren't able to come out today. I'm going to give a quick video here that talks about where some of these therapy dogs came from for WVU and different ways they interact with the patients here at our hospital.
There's something about a dog and a person being together that is hard to describe, but there's definitely a change in people. I think the Caruthers Center started the whole process. So when they asked for a therapy dog, we were very excited to help with that. And that just led to the idea of, wow, we have these dogs that if they're not going to be placed as service dogs, they're probably just going to be released anyway and become a pet somewhere. And they could actually be helping people at the university and employees and college students.
Something that I struggled with coming here was a week before we moved in, my father was killed in a motorcycle accident, which was very hard. And it was very hard to make a decision to come to school. I made that decision because I didn't think I'd come if I didn't come right away. And it wasn't going to change anything if I didn't come. It wasn't going to, it wouldn't help anybody. So for me, coming to West Virginia University, I instantly met Brando, and Brando was that outlet for me to just relax and to help me feel better and be able to cope with not only losing my father, but losing my father and then a week later coming to school and trying to balance his feelings. Brando for me was that outlet. I feel like he's one of my dogs at home. Whatever anybody is dealing with, I think Brando can be a good outlet for them to cope and to feel better.
Brando did not come to our program as a puppy. So he was already 2, I think, when our organization got him. And we didn't really have to do a lot. We had to get him a little bit more socialized to being in public, but he came to us pretty much perfect. He was just a really great dog. One of the main reasons with Gretel was that she was so small. She couldn't do a lot of the stuff a mobility assistance dog needed to do. And she loved people. And so we thought, how perfect is this? She's too small to be a service dog anyways, and she would be much happier like getting attention all day long. Omega is a standard poodle, and she did great with her training.
Omega speak. Oh, okay, good girl.
We had this one problem with Omega where we couldn't get her to stop soliciting attention from people. She just loved people so much. Everywhere we took her, she would try to solicit attention from pretty much everyone that went past. So we thought, well, we'll just make her a therapy dog.
I think a lot of people connect with dogs because they just constantly show you love. And because a lot of people have grown up with dogs, it's something very familiar. I think it's a big step for a lot of people, whether in-state or out-of-state, to come to a big university that's not right near home. And I think that's a hard thing for many people, including me. And I would say having Brando and all the therapy dogs here is something very unique. It's like you're in a big university, but it's an easy place for people to have their own place. In a school with 30,000+ students, Brando can be theirs and Brando can be everybody's dog, so they can feel more comfortable away from home.
All right. So if any of these slides have convinced you guys that you want to order pet therapy for your pets, what are some things you need to think about to adhere to the WVU guidelines? So there are a couple of things we need to think about. There are minimum health requirements for the dog and the owner handler. There are limitations where patients can meet the dogs, and there are limitations for which patients can have these therapy visits. And then we also have to think about infection control considerations. So the most common objection to pet therapy is cleanliness, animal-related allergens, and the risk of zoonotic infections. The biggest concern is the potential for transmitting these infectious diseases to our immunocompromised patients. Though few cases of outbreaks in healthcare facilities related to zoonotic diseases have actually been documented. One study analyzed a random cohort of pet dogs, and there was evidence of zoonotic transmission of agents in 80% of the animals surveyed. They found C. diff on 40% of pet dogs, Pasteurella on 29% of pet dogs, extended spectrum beta-lactamase inhibitors on 4%, and Salmonella on 3%. And these were just pet dogs, not necessarily ones that had been in a hospital setting. However, despite this, the occurrence of human disease attributable to pets is thought to be low overall. Most studies have concluded that immunocompromised patients are not at an additional risk from pet encounters compared to the general population. However, it is agreed that disease risk is not uniform. There are other determinants of risks, including the type of the cancer patients, type of the pet species, the age of the pet, and other hygiene-related aspects of the interaction. Most hospitals have a comprehensive set of guidelines for introducing animals into the healthcare facilities, and these discuss mostly infection control and risk management. There are usually recommendations for animal handlers having proper training prior to visiting the facilities, requirements for the dogs to maintain a certification as an animal-assisted therapist, and then there are also guidelines for how the animal can behave in the hospital-based program. So this is WVU's policy for pet therapy. It addresses most of the things that we discussed before, and it also says who can actually request pet therapy visits. So patients can request pet therapy, but the order actually has to be placed by a physician. It says attending here, but actually residents can place this order as well. So when you go into Epic, you go to manage orders and type in pet visitation, and this window will pop up. You have three options here. One is family pet visitation, which actually allows patients to bring their own approved animals from home. There's pet therapy visitation, which is requesting volunteer services to provide one of WVU's certified therapy dogs to the patient, or a combination of both of those, which is the third option here. And it's up to you which one you wanted to pick for your patient. And then I want to save a little bit of time at the end to allow you guys to actually interact with the dogs one-on-one, but I am available for any questions as well. I've got some references here.